So today we are joined by Dr. Anita Thurakel, who is the Senior Advisor of Maternal and Child Health Bureau, Health Resources and Services Administration, also known as HRSA, HRSA, and that is at the U.S. Department of Health and Human Services. We also have Dr. Antonello Pileggi, who is a program officer at the National Institute of Child Health and Human Development at the National Institutes of Health, which is also at the U.S. Department of Health and Human Services. We have Hillary Bracken, who is the Associate Director of the Patient-Centered Outcomes Research Institute, also known as PCORI, P-C-O-R-I. Sorry. We have Dr. Rachel Caskey, who is the Principal Investigator of University of Illinois Maternal Health Research Center of Excellence, and Catherine Liao, who is the Chief Strategy Officer of Cardiacs. So if we give our panelists a clap. Yeah. And we will go ahead and dive into some things. I'm going to ask you guys some questions. You also don't be shy. Dr. Antonello Pileggi and Dr. Anita Thurakel and Associate Director Hillary Bracken, this question is for you. I want to thank you all so much for being here, but could each of you briefly talk about the maternal health initiatives and funding opportunities led by the agencies that you lead?
Thank you. I guess I break the ice. I'm the shy one, so that somebody has to do it. So thank you, first of all, for the opportunity to be part of this important meeting. I'm very pleased, and I hope that the information we will share will be helpful to all of you moving forward. Improving maternal health outcomes is one of the priorities of NICHD, the institute I represent, and our mantra is healthy pregnancies, healthy children, healthy and productive lives. And definitely this is accomplished through support of research and training in the areas that are relevant to maternal health and the lives of children and adolescents, and the optimization of abilities for all, because we also have the National Center for Rehabilitation Research. As part of this mission, we support fundamental, clinical, social, pharmacological, and technological innovation in this space. For over the past 50 years, the NICHD has supported maternal health and has provided scientific findings that have changed the clinical practice, and enhanced health outcomes. One of the examples is also the Maternal Fetal Medicine Unit, MFMU network, that was established in 1986 and that has carried out randomized clinical trials and other research studies to support new evidence and new practice in pregnant people. This is managed by the Pregnancy and Perinatalology branch at the NICHD, and today we also have the pleasure of having my colleague Diane Gumina representing the branch. So you have two NIHers here in case you have a lot of questions we will try to share. And let me talk about very briefly about the NIH-wide Improve initiative. We heard a lot today from the opening remarks from the representative, the representatives, and I would like to stress this is. We're very grateful for the support that the caucus has given us and the trust in NIH to lead this effort. It was launched in 2019 and is co-led by NICHD, the National Institute of Nursing Research, and the Office of Research in Women's Health. And the goal is to reduce preventable causes of maternal death and improve health for women during, before, and after delivery. And there is also a special emphasis on populations that are disproportionately affected by maternal health. There are 6 complementary programs. We heard already there are 12 Centers of Excellence. 2 were added recently. We have representation today from UIC, so you will hear firsthand on their experience, although it's a recently awarded grant. There is an implementation hub, science hub, and a data innovation and coordinating hub. Those are 12 geographically distributed centers in different locations nationwide with different objectives, but the intention is for them to work together in order to engage with the community partners and develop, implement, and evaluate interventions to address maternal health disparities. We also expect to announce in the fall the winners of 2 challenges. The Connecting the Community Challenge was open to non-academic 501c3 organizations in the US, with a major component being training and mentoring for the participation to build capacity and infrastructures that can conduct research projects and improve maternal health in their communities. Projects in this late phase include evaluation of the impact of doula care and maternal mental health. The Rapid Acceleration of Diagnostic Technology, also known as RADEX Tech for Maternal Health Challenge, was open to any US-based innovator or organization and startups. We have today a representation of one of the technologies that is in the competition. The goal was to foster prioritizing home-based and point-of-care diagnostic devices, wearables, and other remote sensing technologies to improve maternal health outcomes for those living in maternity care deserts. I also would like to stress that the Improve initiative has a website that is constantly updated, and there are often updates on the progress, but also new initiatives being posted there. I think I forgot to start this. Yeah, this is, I think, the most important slide. You have the QR code that links to program announcements, and that can give you a lot of information, but my best advice is to contact the program official associated with any of those programs, and they will be able to help you and guide you. And improve funding, it's a key component of maternal health research supported by the NIH. It constitutes about 43.4 million in fiscal year 2023, and it's part of a 665 million of maternal health funding at the NIH, which is contributed through coordination by various institutes across the agency, and collaboration to ensure complementarity of efforts and synergy in order to complement and potentiate the improve initiatives. So I also want to stress, as you can see on the slide behind me, there are initiatives that are specifically developed for maternal health research projects, but any of the investigator-initiated initiatives can be applied for if you have a question that is pertinent to maternal health. So there is a lot of opportunities to get your research funded. And as was mentioned by Brittany, if you don't apply, you will never get funded. So I think if you want to win the lottery, you need to buy the ticket. So you need to be part of the process. So don't be shy, and we can talk maybe later with some more details on the mechanics. And I stopped. Sorry, I took more than the 3 minutes.
Dr. Thurako?
Hi, good afternoon, everyone. So as mentioned, my name is Anita Thurakal. I'm a senior advisor in the Maternal and Child Health Bureau, which is one bureau of many in the Health Resources and Services Administration. So we're abbreviated MCHB, in case you hear that acronym, in HRSA, and HRSA is one agency of many under Health and Human Services. So our research portfolio is not as great as what is in the NIH, but it's growing. And for HRSA, that's because our focus is really on health systems. So if something touches on health systems, it'll come over to our house. And so this morning, you heard from the amazing Dr. Broner from Morgan State just about one of the investments that we are so happy to talk about here today, and give a big thanks to the Black Maternal Health Caucus, too, for making this a big priority. But our Maternal Health Research Collaborative for minority serving institutions And that is comprised of both the Research Center grants as well as the Coordinating Center grant, which Dr. Broner heads as the Executive Director. And this collaborative really works to understand maternal health disparities. It's looking to build the skills and capacity of MSIs to conduct this research and really find community-based solutions. So this is that bridging of the gap between the research space and what's happening on the ground in the communities that we serve. And it's important because we know that when you have researchers who are coming from underrepresented communities, they understand the complexities of what's going on, they will find solutions that work best for the communities that we're serving. And so this program supports 16 MSIs across the country, and each research institution that's part of this collaborative really focuses on the issues that are core and key to their local communities. So we have a range of different projects that are being pursued. There are some that are looking at workforce, capacity issues, looking at incorporating doulas into care barriers to address to help incorporate more of this type of care, looking at care models focused on preventing serious maternal illness, death, cardiovascular disease, and the prevention of behavioral health issues, maternal health, social risk factors. The list is quite broad and expansive, and we are so excited to see what comes out of this really exciting initiative. So we're still in the early stages of the program and really look forward to seeing the impact that our research centers and with the help of the coordinating center are able to bring about. In addition, we also have the State Maternal Health Innovation Awards, which isn't so much a research grant, but it is grant funding that's open and available to, and another priority of the Black Maternal Health Caucus, but funding that's there and flexible to use towards different innovations that are helpful for those communities that they are serving. So as part of that, there is a state maternal health task force. They come up with a plan that really looks at where the gaps are within the data, what the needs are of the community, and look to implement different innovative solutions. So everything from dyadic care, which is mom and baby come into a center and are getting care at the same time. So mom gets her visit, baby gets their visit, looking at doing simulations, having more hands-on sort of experience for dealing with complications that happen during the birth process. So a range of different things that we're seeing there. And you can go onto the HRSA website to learn more about these and a host of other funding availabilities. But I'll pass it over to my colleagues.
Great. Thank you. Could you pass?
Oh, sorry.
Perfect. Thank you. So again, thank you, Brittany, and thank you so much for inviting PCORI to participate. I joined PCORI as a program officer, and I have to say that being at events like this is so invigorating, in part because we get to see and meet all of you who are potential or current awardees, because we actually have a current awardee here in the audience also. So thank you again for that. I guess to start first, I just wanted to reiterate something that Dr. Cook said this morning. Just to say that PCORI, of course, is not a federal agency. We are an independent, nonprofit research funding organization that seeks to empower patients and others with actionable information about their health and healthcare options through funding by patients, caregivers, and the broader healthcare community. And patient engagement and engagement with communities is fundamental to all of the work that PCORI does. We do our work primarily through funding comparative clinical effectiveness research, or what we call CER. And CER is research that compares the benefits and harms of two or more approaches to care. So that could be care to, for example, prevention, treatment, models of care delivery. So we fund primarily CER research. And as Dr. Cook indicated this morning, maternal health is key and an important part of what PCORI does. It was a focus on maternal health was part of our reauthorization in 2019 and continues to be one of our 12 topic themes. And so we're always interested in research on maternal health at PCORI. We have had to date several funding announcements related to maternal health, both within our investigator-initiated broad pragmatic studies announcement, as well as focused funding announcements related to maternal health. We had one on postpartum outcomes in 2022, another, the partner initiative, which Dr. Cook spoke of this morning, which funded research that was a community partnership together with an academic research team looking at interventions to address both health systems issues as well as the social determinants of health. And so that was our partner initiative. We funded 4 studies under that earlier this year. So again, we've had several of those focused funding announcements, but we are always interested, like NIH, in maternal health within our investigator-initiated announcements. And you can see here, this is a list of our CER announcements and the dates for our 3rd cycle, which is coming up this fall. I'll point you to, you can see there's obviously, they have a wide variety of funding caps and amounts and durations. I would point you to the top, which is our broad pragmatic studies, which is sort of our evergreen announcement that repeats 3 cycles a year with a funding cap of $12 million for 5-year awards. Those are, again, for CER studies. We also fund some work on methods and have some maternal health studies actually in our methods portfolio, as well as the what we call topical or targeted announcements, which are those focused funding announcements specifically on maternal health. Finally, the placer announcement, which you can see there on the, I'm sorry, I'm trying to see where it is on the list, but it's our largest award, needless to say, that funds large-scale randomized clinical trials. The funding cap for this is up to $30 million, so these are really big RCTs, and that announcement actually has an additional year. Because these are more complex trials, we provide an additional year for feasibility and viability of the trial. So that's our placer announcement. PCORI also, I think, given our focus on patient engagement, we also have funding announcements related to encouraging patient engagement in clinical research. And these fall into capacity building. You can see here also there's a convening support program listed there. And that's funding for stakeholders to explore potential topics for CER and to identify evidence gaps that may be, sort of the foundation for future trials. Let's see. And then finally, we also have, as part of our funding opportunities, we have some dissemination and implementation awards, both for interventions that have been tested within PCORI studies and also other, other evidence-based interventions that are ripe for expansion or dissemination into new settings. So with that, I think I'll conclude there, and I look forward to sharing more information about sort of the timing of these awards in the future.
Thank you. Director Bracken, I feel like you kind of got to what my follow-up question was going to be here. And so if all 3 of you could kind of respond to it, and you only in the places that you haven't, but could you all share more about the general life cycle of the grants that you have mentioned, when they're open, how long they're open for, and which are expected to open in the coming months? And of course, please share with the audience where they could find information on these opportunities for funding.
Sure, so I'm happy to jump in. So our funding opportunities are available throughout the year. Usually in the summer, fall months, you'll see postings of notice of funding opportunities go on the website. And they are usually open for about 2 to 3 months because we want to allow enough time to just get all the required information, write a compelling application. And then the awards typically go out about 5 months roughly after the applications are submitted. I think the best place to really start is grants.gov. It's comprehensive, it has everything, and you can really filter by so many different items. So you can see grants that are forecasted, so there's some language in the budget that says that this money might be coming down the pike, and for forecasted grants you might get a 1 or 2 line description of what might be coming. And then you also have posted funding opportunities that will be the full application requirements that you would need to submit. And you can filter by agency, so if you're looking for HRSA grants, you can just go in there, look under Department of Health and Human Services, filter by HRSA, but you can filter by NIH, anyone, any of the federal agencies, and see what's there for you. There are also topics, and you can just go through and see what's available. And this is all funding that's there for you. There are different resources also in each of the funding opportunities. So for every grant that HRSA is issuing, there's going to be a programmatic content contact that you can reach out to for just questions related to just that programmatic aspect, as well as a grants contact. So just folks that can help you with anything required on more, maybe on the administrative end, and just getting things together for the application process. So would encourage you to check out grants.gov. The HRSA website also has content available for preparing a grant application, and we are happy to help. You can always also feel free to reach out to me. I am happy to connect you with whoever can help on your journey, and really that's what we want. The funding is here for all of us, for everyone here, for you, for me, and we're here to just make sure that it gets into the hands of the people who can do the best with it.
Thank you. Yes, go ahead, please.
Thank you. So,
Sorry, Dr. Pileggi, could you get a little closer to the mic?
yes, sure. Sorry, I'm shy at all. So one of the websites that you can look and really has all the comprehensive open announcement is grants.nih.gov. And that's really very comprehensive. You can sort by different mechanisms, but that's pretty much the most comprehensive one. I already alluded to the improved website that is constantly updated. Whenever there is a new announcement, is going to appear there. Generally speaking, there are different types of mechanisms. NIH uses different activity codes, like R01, which is the typical investigator-initiated award, research award. There are the SBIR, STTR, so the business applications that are more geared towards innovation. There are some that are more geared towards high-risk, high-reward, small size type of grants, like the R21 mechanism. And those oftentimes have 3 calls every year. So NIH works on a 3-cycle year based on the council meeting, January, May, and October. And the applications are generally, depending on the type of mechanism, have a different due date. So for R01, for example, is the 5th of February, June, and October. Other mechanisms are different due dates. So I would always recommend to identify the type of mechanisms that work for your questions, and then read the program announcement to see what are the receiving dates. The standard dates generally apply, but for example, so some of those program announcements last for 3 years, so they are available 3 cycle for 3 years. Requests for applications generally are specific programs that are developed to address some unique questions that are priorities, generally have a single receipt date. So for those you want to make sure that you catch them on time and apply on time. And in terms of the timeline, also from application to funding, I want to be sobering here, unfortunately, but it may take up to, I would say, 8 to 20 months from the time of receipt of your application to have an award in hands. And this is for applications that are successful in the first time, because if you need to submit again, then of course the time could double. So this is for the standard type of mechanisms. There are other type of mechanisms like the challenges and the price competitions that are a little bit more agile. Yet, those are different beasts. But still, we try to use all the possible vehicles that can help reaching the new ideas and testing those new ideas in a timely manner, with the caveat that I mentioned, the 20 months. Okay, I stop there for now.
So slow and steady wins the race. Got it. Thank you. Dr. Caskey and Ms. Catherine Liao, thank you all for joining today's panel as well. Each of you has successfully applied for a grant within the agencies represented here. Could you share a bit about this experience, what grant you received, what your hopes are for this funding, and what your experience applying for this funding was like?
It's a lot of questions. Thank you all. I'm Rachel Caskey from the University of Illinois, Chicago, and I'll start by appreciating you all being here today and appreciating these funders being here today. I've had the benefit of getting grants from all three and/or collaborating on grants from all three funding mechanisms, and it's really been an incredible professional journey. It's hard to sum it up as like one experience, but let me just tell you a little bit about some of the work we've done with these awards, and happy to go into more detail as appropriate. I'll also start by saying I am here on behalf of an incredibly talented team. I did not get these awards and get funded. A team of people got these awards and got funded, so it's really important to know. I'll start with HRSA Maternal Health Innovation Award, which we're coming up on our 5th and final year of, and hoping to have another 5 years. We were fortunate to get this funding, and we have been able to do this multi-pronged approach across the state of Illinois. So University of Illinois collaborates with our state health department, as well as collaborators across the state. We created a maternal health task force that represents the whole state, with a diverse group of people and stakeholders that are interested in tackling the issues related to maternal morbidity and mortality from lots of different angles. We helped assist the state in accuracy and speed at which data is collected on adverse outcomes so that we can really do robust analysis. We did education in ERs across the state. My colleague Stacy Geller has worked with, created a team that created a training program for ER clinicians. So if you look at the data in Illinois, among people that had a pregnant or particularly postpartum death, many of them were in an ER weeks before, days before the death. And so we realized this was such a great opportunity to make sure that people are asking. Doctors and nurses are really good at asking if you're pregnant now. They don't often say, have you been pregnant in the last year? And that's a critical question. So even just so much as putting signs up in ERs that empowers patients to say, tell the doctor if you've been pregnant, right? Because again, patients don't often think about it. They have an 8-month-old at home, right? They're like moving on, trying to get into those toddler years. It's important, it's relevant to health outcomes. So educational outreach like that, we did a really wonderful, and it's online if you're interested, storytelling series where we worked with professional storytellers to train people who have had close calls and adverse experiences during pregnancy or the postpartum period to share their stories, and those are all posted on our website. And then it was mentioned that dyadic care model, so we created the first 2-generation clinic here in Illinois, and it was really created using the visits for pediatric visits. As anyone who's had a baby or a grandbaby in the audience knows, there's lots of visits those first 6 to 12 months of life, right? And what we found is so many parents were prioritizing the baby visits and not prioritizing their own visits. So we used the baby visits to ensure moms and partners got connected to care, and it's been a really successful model thanks to the funding that now is self-sustaining. And so it's been wonderful. We just fortunate to receive the NIH U54, which is a maternal health research Center of Excellence Award, and we were funded for 6 years. This is through the improved dollars that were mentioned. And so we were just funded a few weeks ago, so I'm going to tell you what we're planning to do. We have not accomplished anything yet, but we're getting there. We at least got hiring underway. We are going to build an infrastructure for the future. We are building a research infrastructure, training infrastructure across all disciplines, and a community engagement infrastructure so that everything we do has a community voice and the voice of people most impacted at the table. And so hopefully in the future I'll come back and tell you the great work we've done. But we're really excited to get that off the ground so that it's a legacy, that we build a foundation and a structure so that maternal health research can live on well past my retirement. So I'm going to stop there and let you go, but that's just a little flavor. Thank you.
Hi everybody, I'm Catherine Liao. I'm here representing Cardiacs. We are one of the finalists in the RADx Technology for Maternal Health Challenge, and I'm very proud to be able to both represent the company as well as represent my other finalists in RADx who are also doing amazing work. My lens here is slightly different as a medical device innovator and device maker. So how I think about grants, it may be in a slightly different context than the application of the grant dollars to now taking your, for example, what you're working on, Dr. Caskey, is really now taking available technology and then now apply that into a population. Whereas what I'm working on is on the earlier end of it, are there new technologies that can fundamentally change care? And so one thing that RADx is improving is that, so this device is being commercialized in about a month's time, which is recently FDA cleared. What we have done is that we took a 20-plus-year-old technology that can assess your central hemodynamics, so meaning that your arterial health, and packaging that into a device that everyone is familiar with, which is a home blood pressure cuff. Except in the one cuff measurement, we can tell you 6 additional parameters that's related to your heart health. And as we know, the placental development actually changes the vascular structure. And by measuring these metrics, we can actually start to see that change and be able to detect negative alterations much, much earlier and begin intervention sooner. So I'm early stage investigator. This is my 3rd award from the US government. So I've had grants from NIH's NHLBI, which is National Heart, Lung, and Blood Institute, an ICHD with the RADx, and I've also had grant from NSF, National Science Foundation, which is much more focused on technology development. And the big takeaway really, I've lived through that 20-month process. I've also lived through multiple rejected applications as well. And really the thing that you have to do is you have to buy that lotto ticket. You have to enter and apply, and also not get discouraged because none of it, the application analysis process, it's not personal. You are competing against a lot of amazing researchers as well. And the reviewers for each grant cycle are also different. And so sometimes it can feel very discouraging that your second application on the resubmit actually scored lower than the first one after you think you made amazing improvement to your application.
I'll also just mention, I think for science in general, it really is meant to be a team sport. So creating teams that have a lot of rich diversity in background, skill set, training is of benefit no matter what. And I'm speaking on your behalf, but in my experience, that's been most successful, is really putting together a team that brings together a lot of different experts to the table and enhances the opportunities for each individual funding award.
That definitely comes through in the reviewer comments as well. So if there's a weakness in the team, that gets highlighted, and so always kind of preemptively think about how do you make that team as strong as you possibly can, covering the different aspects, not just from a innovation development in my case, but also the scientific, the clinical viewpoints, and the implementation capability as well.
You all, thank you so much. That's a lot of wonderful information. I'm hearing some very common themes about this process, one being the need for awareness. So making sure that you all are aware of where to find these funding opportunities. Just in this conversation, I've heard of 2 websites at least, grants.nih.gov and grants.gov. And Director Bracken, if you could also say for PCORI.
Yes, PCORI, it's PCORI.org. All of our funding announcements are listed there, of course, but I encourage you to sign up for, to get on our mailing list, because we do announce all awards via that mailing list, both for the engagement and for the research awards. So that would be another place to look. And also, we have a number of ways to engage with PCORI, including we're always looking for applications for our advisory panels, for merit reviewers, for patient ambassadors, and so there's a variety of different ways that I especially encourage new investigators or community members that are interested in getting involved with PCORI to look into those opportunities, because I think they're a great first step to understanding how PCORI works.
Thank you. So yes, awareness and being able to find these funding opportunities through these websites that we've shared, that's a key component of things. It sounds also like collaboration, teamwork, leveraging the skills on your team, also leveraging the allies and advocates that you might have in Congress or in your state and local reps, technical assistance at these agencies as well to help you get through that process, which we have heard varies in time from 8 to 20 months or even shorter for some of the other agencies, which is great. And then also resiliency, right? Because when we fail or we don't win something, we don't let that stop us, we let it make us better. So trying on more than one occasion, pushing forward through all of those things and making sure that you all are doing what you need to do to ensure that you can get the funding that our communities need so much. To all of our panelists, I want to ask you all to speak from your experience and walk the audience through some of the best practices and general advice on finding and applying for grants.
Sure. Sure. So there is a slide, there's a printout of it outside, but it's the HRSA top tips for applying. Here we go. So just some general tips, and this is just on top of the contacts that were mentioned that are in the funding opportunities, and in addition to the TA session. So there's usually a technical assistance session that's put out right after the notice of funding opportunity is posted. That's also a helpful resource to just kind of go into things. It's usually live, so you can ask questions during it. And then it's posted after the session is completed. But in addition to that, just some helpful general tips is start preparing early. There are a lot of different components, both from the technical side as well as just financial information and whatnot. So just good to get started early, gathering that information, having a team that's working on these different aspects of the application as you go. Making sure you're following NOFO instructions. NOFO is the abbreviated form of that notice of funding opportunity. So just making sure that all the information is in the order requested, making sure things are clear, keeping in mind the audience that you're writing to as you're writing the application, being brief and clear, being organized, logical with the flow of information. So a lot of times there will be just feedback around not being able to get all the points that are available because a reviewer may not be able to follow the applicant's thought process, or the different pieces don't always fit together. So just being mindful of those sorts of things. And then just making sure you have just evidence of the fiscal management if you're representing an organization or entity, attending to those technical details, and just making sure with attachments, sometimes there are many, making sure everything's labeled properly, going in at the right order, and just reviewing your application, making sure that everything is accurate, complete, and submitting everything at the same time. Just some general tips. And I think there is another slide that's on the opposite side. It has a lot of hyperlinks, but I think if you even just Google these terms, you'll find these websites, but just helpful tips and goes into a little bit more detail on a lot of these concepts that are up here.
Thank you. Thank you. And basically, whatever was just said applies for the edge as well. I would like to add a few more things that may not be applicable. I don't know if it will reciprocate. Definitely, you want to do some intelligence. So there are ways to, so NIH is a National Institute of Health. So there are 27 institutes and centers that are part of the organization, and there is different jurisdiction on some topics and areas. I mentioned that funding for the maternal health is not only is not only coming from NICHD, it's coming also from other institutes, depending on the focus of the research. So it's important that you do some due diligence. You look at the website and look at the priorities of individual institutes and centers that can give you a hint. You should always consider to register in the Notice of Funding Opportunities. There is a weekly mail that goes out, and you will be the first to know which are the new program announcements that are coming out. That's intelligence. You have it in your mailbox, and you can start digging in there. You can always go on the website of the NIH in grants.nih.gov and look at the list there and sort for some buzzwords. You may want also to see what NIH is funding, and you can do that by going on NIH Reporter tool. There is a very nice tool that allows you to make searches based on keywords, or even copying and pasting it into a matchmaker feature, an abstract of your specific aims, and that will show you what is out there that is funded by the NIH. You can track back the abstract of the funded applications, but also who is the point of contact at the specific institute, which institute is paying for that research, which type of mechanisms that are being used. So you can learn a little bit more on how it works. And then, as always, contact a program officer that is listed on a program announcement that you think it's applicable for your questions, and they will be able to either answer your questions or point you to the right person in the specific institute and center. We have a lot of opportunities for new and early stage investigators, non-for-profit organizations, small business, and other for-profit organizations. So even those who are working in the foreign and international organizations, as far as the relevance of the science can be leveraged to priorities for our nation. So there are opportunities also there. So plan ahead, read the NOFO, and you should, that's another important advice. Do not submit on the deadline, because if something goes wrong, you are missing an attachment, there is an error, you have no more time to go back and resubmit. So you should plan ahead of time in order to have at least several days, if not a week, beforehand, so that if something goes wrong, and monitor your email to make sure that you receive the notification so that you can go back and hopefully before the deadline complete your application. We see so many, especially early stage investigators or small companies that are new to the process that sometimes miss opportunities. They have to wait until the next cycle because of that. And then if you are a small business, make sure that you have all the registration in place. There are a lot of things that they need to be checked beforehand. So you don't do this before close to the deadline. Try to really work your schedule backwards to be successful. Sorry if I went long, but.
Sure. So I just would add, for PCORI announcements, investigators are required to submit a letter of intent. And so I encourage everyone who has an idea about something that they're going to send to PCORI to please reach out and speak with a program officer, because we can help perhaps navigate and identify which funding announcement is most appropriate for the idea you have and where it fits in given the number of opportunities that we have. I would reiterate the issue of starting early. At PCORI, all of our research needs to have a strong patient engagement component, and so obviously building those types of relationships and building the appropriate research team takes time. And so again, reach out to us early, talk to us to find out which announcement is the most appropriate, and give you sufficient time to build your team. I would also say we have a speakers bureau, so if you are having an organization at your university, for example, and you wanted to invite a PCORI speaker, we are always happy to come and talk about PCORI funding opportunities and sort of the processes we have. Lastly, on the website, we have a lot of additional resources that might be of help. There is a set of PCORI methodology standards that are minimum standards for all research projects that are funded by PCORI, and so they're a great thing for new investigators to look at to see sort of what the minimum standards are. We also have foundational expectations for engagement with community partners and patients that can be helpful for developing your sort of engagement plan. We published, it's now on the website, there was a report that was generated last year on the use of PCORNet, which is our patient-centered outcomes research network, and the use of PCORNet for maternal health research. That might be a good research, or resource, I should say, for folks that are looking to do research with PCORNet. Again, start early. That's my recommendation with PCORI.
Ditto, yeah.
Well, thank you all so much for sharing this information. We will now open up the panel to questions from the audience, if we have any. Okay, I'll start here.
Good afternoon. I'm Jessica Dupree, Melanated Moms Ambassador. I want to know, you talk so much about being early and starting early. What can you do to prepare even before that, outside of reviewing the website, making sure that you review past award winners? What are some things to have in place before you even start to apply?
So from the HRSA side, and this is also from my experience of being on the side of writing the grants, there are a lot of these administrative requirements that are kind of just the same across many of the grants. So I would just pick up a grant or two and just kind of flip through and see what are those things that you might need that can take some lead time to just get, like the DUNS number and those sorts of things. So just good to review, see if there are some of those things that you can just kind of check off and just have on hand for when there is an opportunity that you do want to apply to. I think also just looking at the forecast is helpful to see what sorts of opportunities might be coming. And you can even just get a sense of the types of things you might want to start thinking about, planning around. And I think even in terms of building that team, getting an idea of how you would want to divide it up, because there are a lot of requirements, just I think both on the technical side and kind of conceptualizing, thinking about what you want to do, but then also a lot of these things that are kind of, the admin operations, sort of a task that I think it's one thing if you're a larger entity that kind of has a machinery around it, but I think it takes time sometimes when you're in a community-based organization and you want to get those ducks in a row before it comes up.
I would love to add to that. Definitely, the whole notion of, the luck favors the prepared, right? I actually found out about RADx less than a month, maybe 3 weeks before it was due, before deadline. And it came through my network. Someone said, hey, I think you would be a fit for it. But it's because I had written a few different applications relating to this topic. I was able to kind of pull in different responses very, very quickly, because there's no possible way to pull together. Well, I mean, it's possible. I've also done that, but you don't want to be pulling together a comprehensive grant application in a space of less than a month. And of course, from a admin perspective, DUNS, SAM's registration, they're getting a cage code. They are all tedious. There's no easy way to do it, and so better off to get that done, so then you could execute when the opportunity arises.
I don't have much to add, just make sure that you read the program announcement, see whether really it fits. You need to have already flushed out your ideas. There might be program announcements that are specific on a topic, and you may be able to pivot because it's already in your area. You should not stretch your idea to fit a program announcement if you are not ready, because then the reviewers will not like it. They will say, wait a minute, you are not ready for that. So you, in many cases, you may want to show or have built some partnership that in the weakness area that you have to make sure they are more competitive. If you don't have them, and when you submit your application, you just, but it's experience. You will learn from your summary statement, and you come back the next time much more round.
I was going to say, I make a huge checklist. I read the entire funding announcement, and I literally write down letter of intent, yes, no, you know, everything. And then you inventory what your team has and what it doesn't have, and think about your networks, right? Who do you already work with or know or could work with that might fill in those gaps? We collaborated in the first 3 minutes on a research project. We just sat down and started talking, and we're going to follow up after.
Coming soon.
Yeah, so, you know, I think it might reframe some of your conversations with colleagues and other networks you have as like, hey, we're thinking about this. Could you partner? You know, and what would that make sense?
I guess I would just add that from PCORI perspective, what I always recommend to new applicants is to we have an Explore the Portfolio feature on a website for maternal health that has a list, a hard-coded list of all of our maternal health studies. So I encourage new investigators to look at it to see examples of what's been funded, but also to not duplicate what's been funded. So to do those two things, and also perhaps you can identify another researcher that you know or within your own institution that has gotten a PCORI award, because PCORI awards are a little bit different than, say, an NIH award, so it's useful to find somebody who has an experience doing the application to kind of walk you through what they did.
And talk to your program officer. Talk to your
Yes.
program officer.
Yes.